All right, guys. A nurse in possibly the scariest patient situation ever has been or is on trial for killing 4 individuals while they were in his care. William Davis, a nurse down in East Texas, has been accused of, not convicted of yet, has been accused of killing 4 individuals who recently received some sort of cardiac surgery. I did not get a specific as to what the cardiac surgery was. However, these patients were placed in his care after receiving cardiac surgery in the ICU. The reports say that Mr. Davis was the nurse with these 4 individuals, and there are also other individuals who did receive serious injuries in Mr. Davis's care. The defense says Mr. Davis was simply in the wrong place at the wrong time. Could be. Prosecution, the lawyers against him, said this comment that actually I completely agree with after they said it. They said that a hospital is the perfect place for a serial killer to hide. And I never thought of it that way. However, after I read that comment, I completely agree with that statement. As bad as that sounds and as sketchy as that sounds, yes, I actually completely agree with that statement. Now, on to what happened and then sort of my theories. These 4 individuals showed what appears to be some sort of stroke on the MRIs, the 4 individuals that have died. I don't know about the individuals that were injured. However, upon further investigation, probably from the hospital or some sort of medical examiner, they determined that air was introduced into the bloodstream, causing these individuals to have their strokes and die. So, what you're saying is you got air in your blood system. It went up in the brain, caused a blockage of some sort, and killed these individuals, much like what a stroke would do. How could you do this? It's really, honestly, not very hard. And anyone who's been through nursing school already understands you do not introduce air into the bloodstream. You just don't do it. Now, in hospitals, at least locally, everything is scanned. You scan every sort of medication that you give this individual. What you don't necessarily have to scan is the syringes, the pushes of saline, things like that. You know, of course, something like a PICC line, you pull, push, blood or saline, depending upon what sort of task you are given. And this is my theory as to how the air got into the bloodstream. I'm assuming that Mr. Davis introduced the air through one of these 10cc syringes, through a PICC line or through an IV access in some way, pushed a bunch of air, and then pushed a bunch of saline behind it so it looked like the lines were cleared out. And then the air went wherever it needed to go, causing these strokes. It is actually easier than what you would like to admit to do. You can either not know what you're doing and mess up this badly, or know exactly what you're doing and mess up this badly. I mean, it was pretty scary how easy this could have been for really anyone to do. And therefore, I completely agree with the statement that the prosecution says that a hospital is a perfect place for a serial killer to hide. If you have demons inside of you to where you want to harm other individuals, and you're creative enough, and you get a job at a hospital, yes, you could cause all sorts of damage to plenty of individuals. Probably many individuals before you get caught. I don't know how many people were injured, but these 4 deaths are what really got Mr. Davis caught with this. As nurses, we take an oath to do no harm first. Mr. Davis is being accused of doing a lot of harm first. This is really scary, especially if you're a patient. These are stories that you really don't want to hear about as a patient, as someone who's going to go into a hospital for maybe an open heart surgery or some sort of procedure. You really don't want to hear about nurses who are introducing air into people's systems and killing them. This is not at all what you want known. Everybody already comes into procedures knowing that there's some sort of risk. However, there's much more risk knowing that, a nurse who works on an ICU unit, not even the doctor, simply just put a bunch of air into some individuals and now they've died. This is terrifying. I would be horrified if I had heard this and I was going to be some sort of patient, getting ready for maybe even just a simple procedure, just because of the simplicity of how everything could have been introduced. It really just doesn't take that much. Now, IV pumps and IV poles and things like this, not necessarily poles, but IV pumps and medications, they have filters and alarms and all these things set in place so that the IV pump itself doesn't pump air. Of course, anybody who's been a nurse for any length of time has heard that dreaded occlusion downstream alarm, or the air in the line alarm, or whatever alarm it is that just does not want that IV to pump. That thing gets aggravating. However, that is a safety feature to prevent air getting into the system, which is what killed these 4 individuals. Now, like I said, he has yet to be proven guilty. He has just been accused of killing 4 individuals. However, he's on trial currently, and I did read an article that if convicted, they are seeking the death penalty. And they don't mess around in Texas. They just don't play down in Texas, especially with the death penalty. Terrifying story that just exists out there. This is a horrifying nurse who did bad things. It's terrifying just to think of how easy this was for one individual to harm plenty of individuals. And there's no telling how he got caught. I haven't figured out how he got caught yet, but I know that somebody sounded the alarm, somebody noticed something. It is just terrifying that it was just this easy to kill these 4 people. I mean, it's something you don't want to think about. It's something you don't want to think about, especially if you're a co-worker of this individual. Whew, terrifying. Hopefully next week we have a little bit of a brighter story than we did this week. You like this video? Check this one out over here. Don't forget to like, share, and subscribe over there. If you like Nurses Making the News on Thursday, there should be a playlist somewhere down below. I don't hope it helps. I hope you learn from this individual and don't do what he did. Always know what you're doing and do the right thing first. Thank you much.